Mr. Monroe. Thank you for coming into the office today.
Sure.
So we are doing a cognitive assessment and cranial nerve exam, correct?
That's correct.
Can you tell me a little bit about what brings you in today?
Sure. About 2 years ago, I had a concussion playing football. So they asked me to come in every 6 months to a year for an evaluation.
Okay.
So it's time for my evaluation.
Okay, so we're just here kind of doing an annual checkup to make sure that everything is still okay.
That's correct.
Okay. And I did see that you have a history of post-concussion syndrome,
Yes.
kind of at baseline, 2 years secondary to your concussion.
Yes, unfortunately.
Okay. All right, well, I'm just going to be taking some notes as we kind of go along today. I
Okay.
do have you here, as we stated, for a cognitive function test, essentially testing for any neurological deficits, any kind of decline since your last exam with your previous PCP.
Right.
So I didn't see anything significant in those notes, aside from the post-concussion syndrome, which we will address today.
Okay.
Unfortunately, it does tend to have long-term effects in a lot of people.
Right.
Okay. And you said you were playing football. Is that just recreational?
I have semi-pro football.
Semi-pro. Okay, wow. All right, so let me just note that down here. Okay. Just to give you a little bit more of a description of what we're going to be doing today. Basically, we call this an annual cognitive screening. We're ruling out any complications secondary to your post-concussive syndrome. I'm testing several things today as far as your orientation and mentation, your current mental status, cognition, your mental and societal awareness, and that kind of thing.
Okay.
Obviously, the goal today is to clear you of any further neurological impairments. So
Right.
I know all of that sounds kind of convoluted. We'll go through it step by step. It is a pretty extensive test, but
Okay.
it's nothing too complicated. Okay.
All right.
So to start, I just really want to obtain your kind of baseline mental status and orientation. Essentially what that means is how alert you are, what we would say with it you are, if you're
Okay.
having any kind of intellectual impairments, that kind of thing. So I'm going to ask you a few questions.
Okay.
Can you tell me your full name?
Sure. James Monroe.
Perfect. And what is your date of birth?
Date of birth is 3/15/1989.
Perfect. All right, and can you tell me how old you are?
Sure. 34 years old.
Perfect. Do you happen to know today's date?
Yes. Today is July 12th, 2023.
Very good. And what day of the week is it?
It is Friday.
Okay, can you tell me what state we're currently in?
Yep. We are in Washington State.
Very good. And would you say we're outside or inside?
We're inside.
Perfect. And can you tell me what kind of building we're in right now?
A brick building, a medical building.
Very good. Perfect. So how did you get here today as far as transportation?
I drove.
Very good. And lastly, can you tell me why you're here?
I'm here for my annual exam post-concussion.
Very good. So based on these questions, I would rate you A&O times 4. Essentially, that means you are alert and oriented to person, place, time, and situation. So you know
Okay.
who you are, why you're here, that kind of thing.
All
Okay.
right.
So let's go ahead and move on to series 2 of the test, which is our cognitive screening. So for
Okay.
this part of the test, I'm going to be asking you a series of questions, having you repeat some things. I might have you write something down, and we're just kind of testing your mental and societal awareness as well as your memory. Okay.
All right.
So I'm going to have you repeat a couple things for me. Can you repeat the following words? Crossover, calendar, community, calming.
Crossover, calendar, community, calming.
Very good. And can I have you repeat these numbers in the exact order that I state them to you?
Okay.
57, 63, 91, 86, 40.
57, 63, 91, 83, 40.
Very close. Let's do that one more time.
Mhm.
57, 63, 91, 86, 40.
57, 63, 91, something, and 40.
Okay. So unfortunately you did get that one incorrect, but it is a little more difficult. So that number that you missed both times was 86. The first time you said 83, which was very close, and the second time you declined to answer, which is okay.
Okay.
So this one's going to be similar, but a little more difficult. So this time I want you to repeat the words in a backwards order from which I state them to you, okay? So a little more difficult here. So 91, 86, 63, 40, 57.
57, 40, 86, 90,
Okay,
53.
very close. Slightly out of order. We'll try that one more time. It's
Okay.
okay if you get it incorrectly. It is a little difficult.
All right.
91, 86, 63, 40, 57.
57, 40, 93, 86, 51.
Okay. Very close, but again, incorrect. That's okay. You have trouble with that third number there. That's all right. Let's go ahead and move on. Okay. So I'm going to have you list the next 4 letters that come after D. You're welcome to say them out loud or recite them, however.
A, B, C, D, E, F, G, H.
Very good. And I'm going to have you solve this series of math problems verbally if you can. 7 plus 5,
7 plus 5 is 12.
12 minus 4,
12 minus 4 is 8.
8 plus 9.
8 plus 9 is 17.
Very good. Okay, now I'm going to have you solve this series of math problems on paper. So I have 3 different math problems here. I'll hand this to you and have you work them out.
Sure.
Try not to look at the bottom of the paper.
Sure.
I know that's a little difficult, but
That's fine.
you're welcome to use any area of the paper as scratch paper if need be. Okay, so we have 16 minus 9.
Oh, 16 minus 9? I think I saw plus.
I think you did. That's okay.
Okay.
So 16 minus 9. I do have to count that as incorrect. You did add it.
I understand.
12 times 2 is 24. 57 plus 94 is 151. So very good. So that first one obviously was a miscommunication. That's okay.
It's all right.
So in the space here, I want you to draw any shape. So I'll hold the clipboard for you if you could draw a shape for me there. And another different shape. And one more different from the first two. Okay, and can you tell me what shape that is?
A triangle,
And this?
a square,
And this.
an octagon.
Very good. Thank you.
Sure.
Okay, so let's move on. I am going to have you count backwards from 30 to 20, skipping the number 24.
All right.
So backwards from 30 down to 20, skip 24.
All right. 30, 29, 28, 27, 26, 25, 23, 22, 21, 20.
Very good. Now I want you to tap your finger on the table anytime you hear me say the letter C.
Okay.
So I'm going to say a series of letters. Anytime you hear the letter C, I want you to tap your finger, okay?
Okay.
2, C, F, T, B, D, C, E, G, C, P, V, T, C. Very good. Just 1 second. Okay. So you did very good with all portions of the test. I am going to bring out a chart here.
Okay.
And this is a stroke evaluation chart. Obviously you didn't have a stroke, but we use this to test other kinds of neurological dysfunction.
All right.
So for this side of the test, I want you to point to the object you would use to open the door. And can you tell me what that is?
That's a key.
Very good. Can you point to the object you would wear on your body?
Sure. These gloves.
Very good. Can you point to the object you think would be the largest in scale in real life?
It's hard to say, either the cactus or the hammock.
Very good. Okay. So I would say the hammock because it is attached to the tree, but I could see why you would say the cactus, so I'll count that as a correct answer.
Okay.
And can you tell me how many pictures you see on this page?
Sure. 1, 2, 3, 4, 5, 6.
Very good. Okay, and can you tell me on this side how many beings are in this picture? I will let you interpret what the word being means.
All right. I see 3 beings. I see 2 children and an adult.
Very good. And which person in this situation is in the most imminent danger given the picture?
The young man that's on the crooked stool up in the air.
Can you tell me why?
He's about to fall at any moment.
Very good. Okay, can you tell me if there's anything about this scenario that's unusual or looks kind of abnormal?
Oh yeah, the adult is washing dishes, but the sink is overrun with water.
Very,
So she's not paying attention to that.
very
Or her
good.
children, if they're her children.
1 second. Okay. Can I have you read these words aloud for me, please?
Sure. Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
Very good. Okay, so can you tell me which word or words on this chart can be read backwards that would still make another word?
Sure. Tip top can also be pot, pit.
Very good. Okay. And on this side, can you point to a verb?
Yes, I can. Speak.
Okay.
I'll point to it, I'm sorry.
That's okay.
Speak.
Can you point to a noun?
Yes. Table.
And a time of day.
Night.
Very good. Okay. So let me just flip over to our last page here. All right, Mr. Monroe, so the cognitive portion of our exam is complete and you did very well. There were 3 answers that you got incorrect, but you still have a passing score. So as far as we are concerned, you are cleared cognitively. We do need to go ahead and start with your cranial nerve exam, which, like I said earlier, is going to just further test for any of those neurological deficiencies, specifically any signs of muscle weakness, sensation loss, anything that would indicate your cranial nerves are damaged permanently, okay? So let me just make a quick note here. So also be checking for any signs of cerebral edema, any signs of cervical stenosis. Essentially checking your eyes, nose, mouth, ears, facial expression, shoulder strength, that kind of thing, okay?
All right.
I do just have a couple of questions here for you, just as far as your health history. So have you been experiencing any numbness, tingling in any of your extremities or your face?
No, I haven't.
Okay. No signs of muscle atrophy or muscular atrophy, which would be like muscle wasting, weakness in your muscles that you've noticed over time, lack of strength?
No, none of that.
Okay. No issues with loss of balance or coordination? Have you been falling more frequently?
No, I
Have
haven't.
you fallen since the last
No,
2 years ago?
I
No.
haven't.
Okay. And no symptoms of a CVA, which would be any interruption of blood flow to the brain. Do you tend to feel dizzy when you stand up? Do you any stroke-like symptoms at all? No facial drooping that's past, anything like that? No
No.
slurred speech?
Nope.
Nobody's told you that they're noticing any adverse symptoms from you?
Nothing, no.
Okay, well, let's go ahead and move on to our test. Why don't we start with your eyes? So, I'm just gonna put a pair of gloves on here. And the first thing I'm gonna test is your pupillary constriction and dilation.
Okay.
So we'll be coming a little closer to you, is that okay?
Sure.
Okay. You're welcome to keep your glasses on. I'm gonna have you look straight at me.
Okay.
And I'm going to be shining a light in either eye. Try not to look at it, just look straight at my face.
Okay.
Just checking for any signs of abnormal pupillary reaction. Checking for equal and bilateral constriction and dilation. Performing what's called a swinging light test. Essentially, I'm swinging my light back and forth like a pendulum to test your pupillary reaction. So continue looking at the center of my face. I'm going to bring this right to the corner of your eye. Very good. And here. Very good. Okay, so no abnormal response there. Was that painful or uncomfortable at all?
No, it wasn't.
Okay, so let's go ahead and move into your ocular motor function. So I'm going to be testing your ability to track the light, to follow it upward, downward, medial, etc. So again, looking straight at my face, I want you to keep your head still, but follow the light with your eyes, okay?
Okay.
Any pain or discomfort with that?
No, it's just very bright,
It's very
but it's
bright,
okay.
okay. I did just change the batteries in my headlight,
Okay.
so it's a little brighter than usual.
They're working well.
Did very well with that.
Thank you.
So let's go ahead and test your visual acuity. My acuity card, there it is. So I want you to have a look at my chart here. I'm going to hold it about that far away from your face. Can you see that okay?
Yes, I can.
Okay. Can you read that top letter for me?
E.
And the third line down?
F P H.
Fifth line down?
D H J B S.
And what is the lowest line you can read?
L T F P H. Bottom line.
Perfect. Can you tell me what color this is?
That's right.
And I'm going to have you occlude one eye. I have an occluder here actually.
Oh, okay, thank you.
So I'll let you decide. Perfect. Can you read that third line down for me?
F P H.
And the very last line you can read.
L T F P H.
And what color is this?
It's red.
And here.
It's green.
Very good. Switch eyes for me. Can you read the fourth line down?
Yes, I can. O L C F.
And the smallest line you can see.
L T F P H.
And these two colors?
They're red and green.
Very good. And can you tell me what that first number is?
It's a 2.
And the last number?
It's a 9.
Very good. So, no issues as far as visual acuity. Are your glasses newer? Prescription is up to date?
Yes, it's up to date.
Good. So your optic nerve is intact. Do you want to go ahead and check your blind spot? So I'm going to do a couple different tests for this, okay?
All right.
First, I want you to have a look directly at the center of my face. I'm going to put my fingers at the side here,
Okay.
and I want you to tell me how many fingers I'm holding up on either side, okay?
All right. 2. I'm sorry, I looked.
It's okay. It's hard not to.
2. 3. 5. 5. 5. 4. 3. 2. 1.
fairly well with that. You did miss one or two, but that's okay.
I think the light was also still in my eye from the other test.
Not a problem. So let's try something slightly different. So I have a little bit of a different style occluder here. Can I have you hold that up?
Sure.
Are you able to see me through?
Yes, I can.
Okay. Can you tell me how many fingers I'm holding up here?
2.
And here?
Should I move my head or keep my head straight?
Keep your head still if you can.
3.
Very good.
I can't see that one.
Can't see it there?
Can't see it,
Okay.
no.
Flip it over for me.
3? 2? I'm sorry, 2.
Good.
Can't see that one. Like 2.
Okay.
1.
Okay. Take the occluder from you. So you do seem to have a little bit of a peripheral defect on that side. Is that something you've heard before?
I don't think so.
Okay. So you did miss a couple for both of those tests.
Yeah.
I do consider it passing because you had a passable score, but the next time you see your optometrist, I would maybe mention to him that your peripheral vision on this side is just slightly lagging in comparison to the other side, okay?
Sure. Okay.
Let's go ahead and test you for any color blindness or color deficiency.
Okay.
So I have what's called an Ishihara test book here, and essentially there are a bunch of different colors. So I want you to tell me what number that is.
12.
Very good. So that is a test. You should be able to see that. And here,
8.
and here,
5.
and here,
29.
Here.
74.
and here.
7. 45.
Very good.
2. And no number there.
Okay.
16. And no number there.
Do you see anything here?
Yeah, there's like a pattern, like a snake.
Very good.
35. 96. And another snake-like pattern.
Can you trace it for me?
Sure.
Perfect. Can you tell me what colors you see here?
Yeah, purple, burgundy, maroon,
And at the top?
pink, rose, red,
And
orange,
what color would you say the background is?
black, and gray.
Very good. Okay. So no suspicion of color deficiency. So your abducens and your color blindness are both normal. I'm gonna go ahead and check your corneal reflex. And apologize ahead of time, this is a little bit uncomfortable.
Alright.
I have, it's essentially a Q-tip here. I'm going to be touching this to the very corner of your eye. I want you to not force your eyes open, but try not to blink until you feel like you have to, okay?
Okay.
Very good. Very good. So let's do that one more time. Okay, so a little oversensitivity on this side.
Okay.
Likely related to that peripheral loss. So
Right.
again, something you should bring up to your optometrist, okay? So we'll do a +1. A +2 would indicate a normal reaction on both sides, but I did see a definite overreaction on this side, okay?
Okay.
So let's go ahead and move on. I do just want to have a look inside your eye.
Okay.
I'm going to be taking my ophthalmoscope here. Essentially, this is just a device that's going to allow me to look inside your eye.
Okay.
So I will have to come fairly close to your face.
Okay.
Can I have you remove your glasses for me?
Sure.
So to start, I'm going to have you look straight ahead.
Alright.
Visualizing the different muscles in your eye. Can I have you look over away from me and towards me? Open wide. Good. And because this side did have a slight defect, I want to have you lean closer a little
Sure.
here. Look straight ahead. Open wide. Look away from me. And look towards me. Okay, so no notable abnormalities there. Alright, so we are all done with your Nice. Let's go ahead and move on to your olfactory nerve or your sense of smell.
Okay.
Do you notice that you have any issues with your sense of smell?
No, I don't think I do.
No. Lack of smell or tasting anything,
Nah.
tasting or smelling anything abnormal?
Nah.
Okay. So I'm going to go ahead and occlude one nostril.
Okay.
Take a normal breath for me. Very good. Okay. So no notable occlusion. Let's move on to a bit of a smell test. So I want you to close your eyes for me. I'm going to hold something up in front of you, and I want you to tell me what it is if you can.
Orange. Citrus.
Okay, citrus.
Or orange or
Let's
lemon.
try this one.
That one might be more lemon.
Okay. This is the second one again.
It's kind of sour. It's hard to tell.
You want the first one again?
Yes, please.
Okay. This is the first one.
I'm not sure. I want to say citrus, orange, or lemon, but there are different types of citrus.
They are different types of citrus. Very good.
Okay.
So let's try one more. Can I have you occlude a nostril? Doesn't matter which one.
Sure.
Can you tell me what that is?
One more time, please.
You want to try the other side?
Yes. It's very strong. It's almost like a vinegar smell, but I can't quite place it. It's not sage.
Okay.
I'm not sure.
I'm going to have you occlude one nostril.
Okay. I didn't get anything with that one, just a slight burning. Let's try the other one. I smell something, but I can't quite tell what it is.
Okay. So let's try this. Go ahead and occlude a nostril.
Mint.
Mint. Let's try that one more time.
Okay. I really don't know.
Okay. So unfortunately, I do have to put you down as a non-passing score for that.
Okay.
So the first one was orange,
Okay.
which you did note initially with both nostrils open. You said it
Right.
was citrusy, but
Right.
kind of sour.
Yes.
It's actually sweet orange.
Okay.
And then the second one was lemongrass, which
Okay.
again you said you weren't quite sure, but it was citrus.
Yeah.
The third one was actually tea tree.
Okay.
So I'm not sure
I was
where you
getting
got
like
the vinegar from, but it is a
Yeah.
very strong
It
smell.
was just like a spice. I
So
couldn't
now
get
that
it.
you have your eyes open, obviously the test is completed, but I just want to see if you can kind of associate
Yeah.
sweet orange.
Yes. Orange peels. I can smell it now.
Okay. This is lemongrass. So it's kind of an earthy,
Okay.
herbally
Yes.
lemon.
Yes. Okay. That was kind of throwing me off.
Tea tree.
Yeah. It does smell like vinegar a little bit.
Okay. Okay, so I'll go ahead and mark that down.
Okay.
Okay, so let's go ahead and move on to your kind of glossopharyngeal hypoglossal reflexes, essentially testing your throat,
Okay.
mouth and throat. So if I can have you open up for me. And say, one more time, Can you raise your tongue up to your hard palate? Very good. And then over, and over the other side. Good, okay. And again, I apologize. This is not the most pleasant part of the examination, but I do need to test your uvula or gag reflex. So go ahead and stick your tongue out. Very good, sorry.
It's okay.
Good job. And I do want to go ahead and do a swallow evaluation. So I'm going to give you this. And I want you to do this in 2 sips. So the
Okay.
first one, go ahead and drink it down. Any issues or abnormalities with that?
No.
Okay. Excuse me while I come around here.
Sure.
So I'm gonna have you do that again. Very good. Can you tell me what that tastes like?
Pineapple.
Good. I'm gonna come behind you for just a second.
Okay.
Just kind of on the side here. Can you open for me? And close. Open, close, open, close. Very good. Just checking for any signs of TMJ or clicking in your jaw.
Okay.
Okay, so all of that was kind of the normal limits. Alright, so let's go ahead and move on to your ear exam. Switching over to my otoscope. So I'm just going to start with having a basic look in both ears.
Okay.
Let me know if this causes you any pain or tenderness if I palpate your ear.
No. No pain, no tenderness.
Okay. Visualizing your eardrum. Very good. No excess earwax. Any pain or tenderness on the side?
Nope.
Okay. Eardrum is pearly gray. Okay, very good. Okay, so we're going to be testing your vestibulocochlear nerve, which is essentially your hearing test.
Okay.
So I have a couple different things. Let's start with the most obvious. So I have a tuning fork here. Can you hear that?
Yes, I can.
Okay. So I'm going to put this at the top of your head. You can close your eyes for me. Can you tell me if you hear that equally in both ears?
Yes.
What side do you hear this on?
The right. The left.
Good. You hear this?
Very lowly. Yes.
Hear anything?
Barely. The right.
Very good. Tell me when the sound stops.
It stopped. It stopped.
Very good. Now I'm going to do another version of that, but with something slightly less obvious. So I have a little device here that makes kind of a puff of air sound.
Okay.
I want you to close your eyes and say left or right, depending on where you hear it.
Okay. Right. Left. 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 Front. Top. Right. 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 Left. Right. Right. Middle, top.
Very good. Okay. So let's do one more. This time I'm just going to make a soft sound with my gloves.
Okay.
I'll move it further away and closer to you, and I want you to just say yes if you hear it and on which side.
The right side. The right side. The left side. The left side. Both sides. Both sides. Left side. Left side. Right side. Front, middle, both sides. Both sides. Right side. Right side. Left side.
Very good. Absolutely no issues with your hearing. Some of those were very quiet and you did hear all of them.
Okay.
So let's move on to your facial nerve, or what's called your trigeminal nerve, and essentially this is going to be testing for any sensation loss in your face.
Okay.
So I have a couple different things that we'll test here. Is it alright if you remove your glasses just
Sure.
so I have a little larger of an area to test?
Sure.
I have a little cotton wisp. I'm just going to test this on your hand. Can you feel that?
Yes.
So you're going to have your eyes closed and just say yes if and when you feel it.
Okay. Yes. 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 Yes.
Very good. Moving on. This one is going to be a kind of soft or sharp test.
Okay.
So can you tell that this is soft
Mhm.
in comparison to this?
Yes.
Okay. So you'll either feel this, this, doesn't matter. One is soft, one is sharp, okay?
All right. Soft. Soft. Sharp. 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 Soft. Soft. Sharp. Soft. 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 Sharp. Sharp. Soft. Soft. Sharp.
Very good, James. No issues or discrepancies with your soft or sharp.
Okay.
Let's move on to something that is more specifically sharp. I have what's called a Wartenberg wheel, and it is fairly sharp.
Okay.
I won't be pressing it hard enough to puncture your skin or anything like that, but you
Okay.
should feel a distinct sharpness.
All right.
So this test is a little different. This time I'm going to glide it across different portions of your face.
Mhm.
I want you to tell me if the sharpness decreases at any point, okay?
Okay.
So does it feel the same here and all the way across here?
Yes, it does.
And here?
Yes.
Here versus here?
Yes.
Forehead, nose, chin.
Yep. Same. Same.
Any difference on either side? It should feel
No.
equal.
There's no difference.
Okay, very good. So your trigeminal nerve appears to be intact. And I do want to bring that down very briefly to your arms.
Okay.
So using the soft or sharp, I want you to tell me if you feel soft or sharp on either arm, okay?
Okay. Soft. Soft. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp. 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 Soft. Sharp. Soft. 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 Sharp. 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 Soft. Soft. Sharp. Soft. Soft. Sharp.
Very good, okay. And then lastly, similar to the last test we did on your face, you can keep your eyes open. Does this feel any different as we progress down your arm?
No, it does not.
Feels the same here, here.
Yep.
Okay. And this also tests your lumbar function, your spine is connected to your arms. I know that sounds odd, but testing your
It feels the same.
arms here, all of that is
Yes.
very good. So let's go ahead and move on to the last part of our examination today, which is testing your accessory nerve or your musculoskeletal movements. So what I'm going to do is I'm going to have you do a couple things against resistance.
Okay.
So can you turn your head into my hand?
Sure.
Don't let me turn it back. Other side. And back. And down. And open. And close. Don't let me open. Can you close your eyes real tight? I'm going to pull these down for just a second. Can you scrunch your eyebrows? And scrunch your nose. Very good. Okay. So I'm going to have you shrug your shoulders. Don't let me push them down. Can you close your arms out like this? Don't let me pull them back. Now push back towards me. Very good. Can you open your hands like this? Don't let me bring your fingers together. Now I'm gonna have you just like this. So kind of crab fingers, there you go. Don't let me move your thumb. Now I want you to squeeze my hand as hard as you can theoretically. Don't, okay, very good from this side. Okay, very good. Now I want you to bring your arm kind of out. Try not to let me push it down. Now push down against me. And do the other side. Down against me. And don't let me push it up. Can you hold your hand straight out like this? Close your eyes for a second. Very good, go ahead and open. Okay. Your accessory nerve appears to be intact. No discrepancies there. And I believe that is all I have for you today, James. You passed, essentially. There were a couple things that you missed, but nothing major. I do think the post-concussion syndrome is still here, unfortunately. You are still showing some signs and symptoms. I did notice some very light, like mild light sensitivity in this eye, more so than the other. The peripheral vision was slightly inaccurate, as well as the overcompensation with the corneal reflex test, which is the Q-tip to your eye. You were almost anticipating it with this side, which lets me know that you tend to have some sensitivities more so on this side.
You're right.
Is that something you notice kind of on a day-to-day basis? Okay.
Yeah.
So obviously that was slightly abnormal. As far as your cognitive screening and your neurological assessment, you did miss a couple of the repetition numbers. That's not something that I maybe think is related. It is a difficult test. I don't think it's anything that, you know, is suggestive of any kind of neurological or cognitive deficits as far as I'm concerned with that test. I do, however, want you to at least mention the abnormalities to your optometrist the next time you see them. I will send these over just so they have the notes. They don't always follow up, so if you wanted to reach out and just mention it to them, maybe they could do, you know, an earlier screening for you.
Hopefully, yeah.
Everything else, as far as your cognitive screening, was completely normal. And then as far as your cranial nerve exam and testing the neurological deficiencies, your musculoskeletal strength and all of that was totally intact. So I'm not sensing that you have any what I would consider permanent nerve damage from your concussion, but I do think the post-concussion syndrome diagnosis is still appropriate at this time.
I understand.
So as your PCP stated before, we would like to have you continue to come in every 6 to 12 months. 12 months really, every 6 months unless you're feeling some sort of decline. 12 months I think is appropriate given how you did on this test today, okay? So if you'd like to schedule that ahead of time, we can do that for you. If not, you can call in when it's time for your next appointment.
Go ahead and schedule it.
Okay. So if you want to head to the front desk, the receptionist up there can help you get that scheduled, and we'll give you a reminder card, and then obviously, you know, give us your preference as far as email or whatever the case is, and we can remind you when it's closer to that appointment date, okay? Okay. Well, thank you so much. I hope you have a nice day, and I'm not seeing any cause for concern today, okay?
Okay, good.
All right. Thank you. Have a good day.
Thank you.
Soft or sharp? Soft or sharp? Soft or sharp? Soft? Sharp. Baby cat? Soft or sharp? Is it soft Bruce, am I looking at you? Mm. Mm. Follow the light, baby cat.